Sarah Martinez walked through the automatic doors of St. Mary's Medical Center on a crisp Monday morning in September. At 28, she carried herself with quiet confidence, her dark hair pulled back in a neat ponytail, and her scrubs freshly pressed. This was her first day at one of the most prestigious hospitals in the city, and she had worked hard to get here. The emergency department buzzed with activity as Sarah approached the nurses' station. Dr. Richard Hartwell, the head of emergency medicine, barely looked up from his clipboard when the charge nurse, Mrs. Thompson, introduced her. "This is Sarah Martinez, our new nurse," Mrs. Thompson said with a warm smile. Dr. Hartwell glanced at Sarah briefly, his eyes taking in her young appearance and fresh-faced demeanor. "Another new graduate, I suppose," he muttered under his breath, loud enough for several nearby staff members to hear. "Hope she can handle more than taking temperatures." Sarah felt her cheeks flush but kept her expression neutral. She had dealt with this attitude before during her clinical rotations. Many doctors assumed that young nurses lacked experience and competence. Dr. Jennifer Walsh, a senior attending physician, joined the conversation. She looked Sarah up and down, with barely concealed skepticism. "You look awfully young, dear. How long have you been nursing?" "I graduated 2 years ago," Sarah replied politely. "I've been working at Metro General Hospital in the trauma unit." "Metro General?" Dr. Walsh exchanged a look with Dr. Hartwell. "That's quite different from our standards here. This is a teaching hospital. We handle complex cases that require real expertise." The other nurses at the station shifted uncomfortably. Some of them remembered their own early days and the challenges of proving themselves. But others had worked with the doctors for so long that they had adopted similar attitudes toward newcomers. "I'm sure Sarah will do just fine," Mrs. Thompson said diplomatically, trying to diffuse the tension. "She comes with excellent recommendations." Dr. Hartwell snorted softly. "Recommendations don't mean much when you're dealing with life and death situations. We'll see how she handles her first real emergency." As the morning progressed, Sarah was assigned to Dr. Hartwell's team. She quickly noticed the dynamics at play. The senior nurses moved with practiced efficiency, barely speaking unless spoken to by the doctors. The physicians made decisions quickly and expected immediate compliance without question. During rounds, Dr. Hartwell would often skip over Sarah when discussing patient care, directing his comments to the more experienced nurses instead. When she tried to contribute observations about patients she had been assigned to, he would cut her off with dismissive comments. "I don't need nursing theories right now," he said when Sarah mentioned a patient's elevated anxiety levels might be affecting his blood pressure readings. "I need facts and medication administration." Dr. Walsh was even more direct in her criticism. During lunch break, Sarah overheard her talking to a group of residents in the break room. "These young nurses come in thinking they know everything because they've read some textbooks," Dr. Walsh was saying. "They don't understand that medicine is about experience and instinct, not just following protocols." Sarah pretended to focus on her sandwich while listening to the conversation. One of the residents, Dr. Kim, glanced at her sympathetically but didn't speak up. The afternoon brought a steady stream of patients to the emergency department. Sarah worked efficiently, checking vital signs, administering medications, and monitoring patients' conditions. She noticed things that others might miss: a subtle change in a patient's breathing pattern, early signs of confusion that could indicate a serious complication, or small details in a patient's history that might be relevant to their current condition. But every time she tried to share these observations, she was met with eye rolls or dismissive comments from the attending physicians. Dr. Hartwell seemed particularly irritated by her attention to detail. "Stop overthinking everything," he told her when she expressed concern about an elderly patient's sudden change in demeanor. "Not every little thing is a medical emergency." The patient in question was Mrs. Chen, an 80-year-old woman who had come in after a fall at home. The initial X-rays showed no broken bones, and her vital signs were stable. But Sarah noticed that Mrs. Chen seemed unusually confused and kept asking the same questions repeatedly. "Doctor, I think we should consider that Mrs. Chen might have hit her head harder than initially thought," Sarah suggested quietly. Her confusion seems to be getting worse. And she mentioned feeling dizzy. Well, meaning dizzy. Dr. Hartwell looked up from his notes with obvious annoyance. Her CT scan was normal. She's elderly and probably just shaken up from the fall. We don't need to run every test in the book for every patient who seems a little confused. Sarah bit her tongue but continued to monitor Mrs. Chen closely. She documented every change in the patient's condition, noting the progression of confusion and the subtle changes in her responses. As her shift continued, Sarah encountered Dr. Michael Torres, a trauma surgeon who had a reputation for being demanding but fair. Unlike the emergency department physicians, Dr. Torres actually listened when Sarah provided patient updates. "You have a good eye for detail," he told her after she provided a thorough report on a trauma patient they had worked on together. "Keep that up. It will save lives." Sarah felt a moment of validation, but it was quickly overshadowed by another encounter with Dr. Walsh. The physician had been watching Sarah work with patients and approached her near the end of the shift. "Martinez," Dr. Walsh called out, using Sarah's last name in a way that felt deliberately impersonal. "I've been observing your work today." Sarah turned to face her, preparing for another critique. "You spend too much time with individual patients," Dr. Walsh continued. "This is an emergency department, not a nursing home. We need efficiency, not hand-holding." The criticism stung because Sarah genuinely cared about providing compassionate care to her patients. She had been taught that treating patients as human beings, not just medical conditions, was an essential part of nursing. "I understand the need for efficiency," Sarah replied carefully. "But I also believe that taking time to really observe patients can help catch problems early." Dr. Walsh shook her head. "That's exactly the kind of thinking that will get you in trouble here. Follow the protocols, do your job, and leave the medical decisions to the doctors." As Sarah gathered her belongings at the end of her shift, she felt emotionally drained. She had expected some challenges in her new position, but the constant dismissal and condescension had been harder to handle than she anticipated. Mrs. Thompson approached her as she was heading to the parking lot. "Don't let them get to you, honey," the charge nurse said kindly. "Some of these doctors have been here so long they forget what it's like to be new." Sarah managed a weak smile. "I just want to do good work and help patients." "I can see that," Mrs. Thompson replied. "And for what it's worth, I think you did excellent work today. That attention to detail you have, that's going to serve you well here, even if some people don't appreciate it right now." That evening, Sarah sat in her small apartment, reflecting on her first day. She thought about Mrs. Chen and wondered if she should have pushed harder about her concerns. She thought about the dismissive attitudes she had encountered and wondered if she was strong enough to handle this environment long-term. But Sarah had not gotten this far by giving up when things got difficult. She had worked her way through nursing school while supporting herself, had excelled in challenging clinical rotations, and had earned her position at this prestigious hospital through hard work and dedication. As she prepared for bed, Sarah made a mental note to continue documenting her observations carefully and to speak up for her patients, regardless of how the doctors responded. She knew that nursing was about more than just following orders. It was about being an advocate for patients and using her skills and knowledge to provide the best possible care. The next morning would bring new challenges, but Sarah Martinez was determined to prove that being young and new didn't mean being incompetent. She had something valuable to offer, even if others couldn't see it yet. 3 weeks had passed since Sarah's first day at St. Mary's Medical Center. The initial hostility had settled into a routine of casual dismissal and professional coldness. Dr. Hartwell continued to treat her as little more than a medication dispenser, while Dr. Walsh made pointed comments about inexperienced staff whenever Sarah was within earshot. Despite the challenging environment, Sarah had found her rhythm. She arrived early each shift, stayed late when needed, and continued to provide thorough, compassionate care to every patient assigned to her. Some of the other nurses had begun to warm up to her, particularly after she had quietly helped several of them during busy periods without being asked. On this particular Thursday afternoon, the emergency department was experiencing an unusually hectic day. A multi-car accident had brought in several trauma patients, and the staff was stretched thin. Sarah was assigned to the overflow area, caring for less critical patients while the trauma team worked on the more serious cases. Among her patients was James Morrison, a man in his early 30s who had been brought in by ambulance after collapsing at his office job. The paramedics reported that he had been found unconscious by a coworker and had regained consciousness during transport. His vital signs were stable, and the initial assessment suggested possible dehydration or low blood sugar. Sarah introduced herself to James and began her routine assessment. Something about his demeanor immediately caught her attention. While he was polite and responsive, she noticed a certain military bearing in how he held himself. Even while lying on the hospital bed, his hair was cut in a precise military style, and despite his casual business clothes, he carried himself with unmistakable discipline. "Have you been feeling unwell recently?" Sarah asked as she checked his blood pressure. "Just tired," James replied, his voice steady but strained. "I've been working long hours lately." Sarah nodded and continued her assessment, but she couldn't shake the feeling that there was more to his condition than simple fatigue. His hands showed calluses that suggested physical training, and she noticed what appeared to be surgical scars on his arms that were partially hidden by his shirt sleeves. "Mr. Morrison, were you in the military?" she asked gently. James hesitated for a moment before nodding. "Navy SEAL, retired last year." This information immediately changed Sarah's perspective on his case. She had worked with veterans during her time at Metro General and knew that many combat veterans struggled with invisible wounds that weren't always apparent in standard medical assessments. "Are you receiving any treatment through the VA?" she asked. "Some," James replied vaguely, clearly uncomfortable with the direction of the conversation. Dr. Hartwell appeared at the bedside, barely glancing at Sarah before focusing on the patient. "Mr. Morrison, I'm Dr. Hartwell. What seems to be the problem today?" "I collapsed at work," James explained. "Probably just exhaustion." Dr. Hartwell quickly reviewed the paramedic report and the initial vital signs. "Blood pressure is good, heart rate normal. We'll run some basic labs and get you out of here quickly." Sarah watched the interaction carefully. She had noticed subtle signs that Dr. Hartwell had missed. A slight tremor in James's hands. The way he kept scanning the room, as if assessing threats, and how he startled slightly at unexpected sounds from the busy emergency department. "Doctor," Sarah said quietly, "I think we should consider—" "I've got this handled, nurse." Dr. Hartwell cut her off without looking at her. "Please draw blood for the standard collapse workup." Sarah bit back her response and went to gather the supplies for drawing blood. As she worked with James, she continued to observe his behavior and ask gentle questions about his symptoms. She learned that he had been having difficulty sleeping, had been experiencing headaches, and had been struggling with concentration at his new civilian job. The combination of symptoms, along with his military background, raised red flags for Sarah. She suspected that James might be dealing with post-traumatic stress disorder or traumatic brain injury, both common among combat veterans. The collapse could have been triggered by a panic attack or could be related to medication he might be taking. When the blood work results came back normal, Dr. Hartwell prepared to discharge James with instructions to follow up with his primary care physician if symptoms continued. "Wait," Sarah said, approaching the doctor with her concerns. "I really think we should dig deeper into his history. He's showing signs that suggest—" "That suggest what?" Dr. Hartwell asked impatiently. "His labs are fine. His vital signs are stable. There's no medical emergency here. He's a combat veteran," Sarah persisted. "The symptoms he's describing, combined with his military history, could indicate PTSD or TBI. The collapse might be related to—" Dr. Hartwell held up his hand to stop her. "Listen, Martinez. I appreciate that you think you're being thorough, but this man fainted at work. It happens. We don't need to turn every simple case into a complex psychological evaluation." End quote. Sarah felt her frustration mounting. She looked over at James, who was clearly listening to their conversation. His expression had become more guarded, and she could see that the dismissive attitude was affecting him as well. "But doctor," she tried again. "That's enough," Dr. Hartwell said firmly. "Process his discharge papers." Before Sarah could respond, Dr. Walsh appeared at the bedside, having overheard the tail end of the conversation. Is there a problem here? She asked. Our eager new nurse thinks she's qualified to diagnose psychiatric conditions, Dr. Hartwell said with obvious sarcasm. Dr. Walsh looked at Sarah with barely concealed irritation. Martinez, this is exactly what I was talking about. You're overstepping your scope of practice and wasting everyone's time with unnecessary speculation. Sarah felt her face burn with embarrassment and anger, but she forced herself to remain professional. I'm not trying to diagnose anything. I'm just suggesting that we consider all possibilities before discharge. The possibilities we consider are medical possibilities, Dr. Walsh replied coldly. Not every patient needs a social work consultation or psychiatric evaluation. Some people just faint. Seaver 5. James had been listening to this exchange with growing discomfort. Sarah could see that the doctor's dismissive attitude toward his military service and potential mental health concerns was affecting him negatively. I'm fine, James said quietly, clearly wanting to end the uncomfortable situation. I just want to go home. Sarah's heart sank as she watched James begin to withdraw emotionally. She had seen this reaction before in veterans who felt dismissed or misunderstood by civilian medical providers. The stigma surrounding mental health issues, particularly among military personnel, often led to patients minimizing their symptoms to avoid further scrutiny or judgment. Dr. Hartwell nodded approvingly. See, the patient agrees. Please process the discharge. As Sarah reluctantly began preparing the discharge paperwork, she made one last attempt to connect with James privately. Mr. Morrison, here's information about veteran services in the area, she said quietly, handing him a small card she kept for such situations. Sometimes it helps to talk to people who understand. James looked at the card and then at Sarah, something shifting in his expression. Thank you, he said softly. Not many people. Thank you. Dr. Walsh, who had been watching this interaction, shook her head disapprovingly. Martinez, a word. Sarah followed Dr. Walsh to a corner of the department where they could speak privately, though several staff members were clearly listening. What you just did was completely inappropriate, Doctor, Walsh said. You undermined the medical team's decision and potentially created anxiety for the patient by suggesting he has psychiatric problems. I was trying to provide resources, Sarah replied, struggling to keep her voice steady. Veterans often need specialized care. That's not your decision to make, Doctor, Walsh interrupted. You're a nurse, not a social worker, not a psychiatrist, and certainly not a doctor. Your job is to follow orders and provide basic care, not to second-guess medical decisions. Sarah felt the eyes of her colleagues on her as Dr. Walsh's voice carried across the department. She knew that this public reprimand would be talked about and would further damage her already precarious standing with the medical staff. I understand your concerns, Sarah said carefully. But I believe patients deserve comprehensive care that addresses all their needs. Dr. Walsh's expression hardened. What patients deserve is competent medical care from qualified professionals. If you can't accept that, perhaps you should consider whether this is the right place for you. The threat was clear, and Sarah felt a chill run through her. She had worked too hard to get to this position to lose it now. But she also couldn't ignore her instincts about patient care. As Dr. Walsh walked away, Sarah noticed that James was being wheeled toward the exit. She caught his eye briefly and saw something there. Gratitude, perhaps, or recognition that someone had tried to understand what he was going through. The rest of her shift passed in tense silence. Word of her confrontation with the doctors had spread through the department, and Sarah could feel the judgment of her colleagues. Some looked sympathetic but said nothing, while others seemed to agree that she had overstepped her bounds. Dr. Torres found her near the end of her shift as she was restocking supplies in one of the trauma rooms. Heard you had some excitement today, he said casually. Sarah looked up, unsure how to respond. I was just trying to advocate for a patient. I know, Dr. Torres said. For what it's worth, I think your instincts were probably right. Veterans can be complicated cases, and a lot of their issues get missed in standard emergency department protocols. The validation meant more to Sarah than she could express, but she also knew that one supportive doctor couldn't protect her from the hostile environment she was working in. I just wish I could have helped him more, she said quietly. Dr. Torres nodded thoughtfully. Sometimes the best we can do is plant a seed. Maybe that resource card you gave him will make a difference down the road. As Sarah drove home that evening, she couldn't stop thinking about James Morrison and the way he had been dismissed by the medical team. She wondered if she had done enough, if there was something more she could have said or done to ensure he received proper care. What she didn't know was that her small act of compassion and advocacy had made a deeper impression than she realized, and that the consequences of this seemingly routine patient encounter would soon change everything at St. Mary's Medical Center. 2 weeks after James Morrison's visit, Sarah had almost pushed the encounter to the back of her mind. The daily challenges of working in an environment where her competence was constantly questioned had consumed most of her mental energy. She continued to provide excellent patient care, but the constant undermining from the attending physicians was taking its toll. On this particular Friday morning, the emergency department was bustling with the usual mix of urgent cases and routine problems. Sarah was assigned to triage, which meant she would be the first medical professional to assess incoming patients and determine the priority of their care. Around 10 in the morning, the automatic doors opened, and Sarah looked up from her computer to see a familiar figure walking through. It was James Morrison, but he looked completely different from the man she had treated 2 weeks earlier. He was wearing a crisp military dress uniform. His posture was confident and commanding, and he moved with the authority of someone accustomed to leadership. Sarah blinked in surprise, wondering if she was seeing things correctly. The man who had been dismissed as a simple fainting case was now clearly identified as a high-ranking military officer, with ribbons and insignia that spoke to significant achievements in service. James approached the triage desk, and Sarah could see that he recognized her immediately. "Nurse Martinez," he said with a slight smile. "I was hoping to see you." "Mr. Morrison," Sarah replied, still processing the dramatic change in his appearance. "Are you feeling better? Do you need medical attention?" "Actually, it's Captain Morrison," he said gently, "and I'm here for a different reason today." Sarah noticed that James's presence in uniform was already attracting attention from other staff members. His bearing and the impressive array of military decorations made it clear that this was not an ordinary patient or visitor. "I wanted to thank you," James continued, his voice carrying clearly in the suddenly quieter triage area. "What you did 2 weeks ago, the way you listened and tried to help, it made a difference." Sarah felt confused and slightly embarrassed by the attention his words were drawing. "I just did my job," she said quietly. "No," James replied firmly. "You did much more than that. You saw something that others missed, and you tried to help even when it wasn't easy." Dr. Hartwell had noticed the commotion and approached the triage desk, his expression showing curiosity mixed with his usual impatience. "Is there a problem here?" he asked. James turned to face Dr. Hartwell, and Sarah could see the doctor's expression change as he took in the uniform and the obvious authority that James carried. "Dr. Hartwell, isn't it?" James said, his voice polite but commanding. "We met briefly when I was here as a patient." Dr. Hartwell's demeanor immediately shifted as he recognized the man he had dismissed so casually 2 weeks earlier. "Oh, yes, of course. I hope you're feeling better?" "Much better, thanks to Nurse Martinez here," James replied, his words causing Dr. Hartwell's face to show confusion and growing concern. By this time, Dr. Walsh had also arrived, drawn by the unusual scene of a decorated military officer in the emergency department triage area. Sarah watched as the doctor's confident expression faltered when she saw James in uniform. "Captain Morrison was telling me how Nurse Martinez helped him during his visit," Dr. Hartwell said to Dr. Walsh, his tone now much more respectful than it had been when discussing the case 2 weeks earlier. James nodded and addressed both doctors directly. "I want you to know that this young woman potentially saved my life. When I was here before, I was in crisis, dealing with severe PTSD and traumatic brain injury from my service in Afghanistan. I had stopped taking my medications and was having panic attacks that I was trying to hide." Sarah felt her heart skip a beat as she realized that her instincts about James's condition had been completely correct. James continued, his voice steady and authoritative. "Nurse Martinez recognized that there was more going on than simple exhaustion. She asked the right questions, showed genuine concern, and gave me information about veteran services. Most importantly, she treated me with dignity and respect when I felt like giving up. Dr. Hartwell and Dr. Walsh exchanged uncomfortable glances, clearly remembering how they had dismissed Sarah's concerns about the patient. The card she gave me led me to a veteran crisis counselor, James went on. I got back into treatment, reconnected with my support system, and started dealing with issues I had been ignoring. Without her intervention, I'm not sure I would have made it through that week. The triage area had grown very quiet as staff members stopped their work to listen to this unexpected testimonial. Sarah felt overwhelmed by the revelation and by the public nature of James's gratitude. Furthermore, James continued, his voice taking on an even more formal tone, I want you to know exactly who you're dealing with here. Nurse Martinez showed the kind of assessment skills, compassion, and courage under pressure that we value most in military medical personnel. He turned slightly so that his uniform decorations were clearly visible to everyone present. I'm Captain James Morrison, Navy SEALs. I served 3 tours in Afghanistan and was awarded the Silver Star for gallantry in action. I mention this not to boast, but because I want you to understand that I know good leadership when I see it. Sarah could see that several staff members were now staring openly at James's ribbons and medals, clearly impressed by his credentials and service record. This nurse, James said, gesturing toward Sarah, demonstrated exactly the kind of professional judgment and patient advocacy that saves lives in combat medicine. She saw what others missed, asked difficult questions when it wasn't popular to do so, and followed through with resources that made a real difference. Dr. Hartwell cleared his throat uncomfortably. Captain Morrison, we're very glad that you received the help you needed. Are you? James asked, his tone becoming more challenging. Because from what I observed during my visit, this nurse's professional judgment was dismissed, and her expertise was questioned by staff who didn't take the time to really assess the situation. The criticism was delivered with military directness, and Sarah could see that both Dr. Hartwell and Dr. Walsh were struggling with how to respond. I'm sure there was no intention to, Dr. Walsh began. With respect, Doctor. James interrupted. There absolutely was an intention to dismiss this nurse's input because of assumptions about her experience and qualifications. I heard the conversation. I saw how she was treated. Sarah felt a mixture of gratitude and anxiety as James continued his defense of her actions. She appreciated his support, but she was also worried about the potential consequences of this confrontation. What concerns me most, James continued, is that this kind of attitude could cost lives. In my case, it nearly did. If Nurse Martinez hadn't pushed back against the quick discharge and provided me with resources, I might not be standing here today. Mrs. Thompson, the charge nurse, had been listening to the entire exchange from nearby. She stepped forward with a supportive expression. Captain Morrison, we're very grateful that you took the time to come back and share this with us. James nodded to Mrs. Thompson respectfully. Ma'am, I'm here because I believe in recognizing excellence when I see it. In the military, we know that good people sometimes have to work in challenging environments, and it's our responsibility to support those who demonstrate courage and competence. He turned back to Sarah with an expression of genuine respect. Nurse Martinez, I want you to know that your actions were professional, appropriate, and potentially life-saving. Don't let anyone convince you otherwise. Then James did something that shocked everyone present. In a gesture that was both unexpected and deeply meaningful, he came to attention and rendered a crisp military salute to Sarah. Thank you for your service to veterans and for the courage to do what's right, even when it's difficult, he said formally. The emergency department fell completely silent. Sarah, overwhelmed by the gesture and its implications, managed to respond with a respectful nod. Unsure of the proper protocol for receiving such an honor, the salute lasted several seconds, during which every person present understood that they were witnessing something significant. A decorated war hero was publicly honoring a young nurse who had been dismissed and undermined by her colleagues. When James finally lowered his hand, he addressed the group one more time. Excellence in patient care comes from people who are willing to see beyond the obvious, who ask hard questions, and who advocate for those in their care. That's what I witnessed from Nurse Martinez, and that's what every patient deserves. Dr. Torres, who had been watching from the edge of the group, stepped forward with obvious approval. Captain Morrison, thank you for taking the time to share this with us. It's important for us to hear how our care affects patients. It's important for good people to be recognized for good work, James replied. And it's important for organizations to understand the value of the people they have. As James prepared to leave, he handed Sarah a business card. If you ever decide you want to work with veterans more directly, I know people who would be very interested in someone with your skills and dedication. Sarah took the card with hands that were slightly shaking. Thank you, Captain Morrison. I'm just glad you're doing better. I am, he said with a genuine smile. Thanks to you. After James left, the emergency department slowly returned to its normal rhythm, but the atmosphere had fundamentally changed. Sarah could feel the difference in how her colleagues looked at her and spoke to her. The public recognition from a decorated war hero had shifted the dynamics in ways that she was still processing. Dr. Hartwell approached her later that day, his manner notably different from their previous interactions. Martinez, I want you to know that I respect what Captain Morrison had to say about your patient care. Sarah nodded diplomatically. Thank you, Doctor. Perhaps, Dr. Hartwell continued somewhat awkwardly, we should look at creating better protocols for assessing veterans who come through the emergency department. It was a small acknowledgement, but Sarah recognized it as significant progress. Dr. Walsh, however, had made herself scarce for the rest of the day, clearly uncomfortable with the public criticism of her treatment of Sarah. As Sarah finished her shift that evening, Mrs. Thompson pulled her aside. You know, honey, in 30 years of nursing, I've seen a lot of things, but I've never seen anything quite like that. Sarah smiled tiredly. I'm still processing it all. What that young man did today, Mrs. Thompson continued. That took courage. But more than that, it showed real character. You made an impression on him because you cared enough to see beyond the surface. Sarah thought about the events of the day as she drove home. She realized that James Morrison's visit had been about more than just thanking her. It had been about standing up for the principle that good patient care requires listening, observing, and advocating, even when it's uncomfortable or unpopular. The salute had been a powerful symbol. But the real message was simpler. Competence and compassion should be recognized and supported, regardless of someone's age or experience level. Sarah knew that her working environment would never be the same, but more importantly, she felt validated in her commitment to providing the best possible care for every patient who trusted her with their health and well-being. That evening, Sarah looked at Captain Morrison's business card and smiled, knowing that whatever challenges lay ahead, she had been reminded of why she became a nurse in the first place: to make a difference in people's lives, one patient at a time.